Hi, I'm Dr. Rodríguez-Feliz, board-certified plastic surgeon in Gables, Florida. Today I'm here in one of our treatment rooms where we perform hair transplantation. So hair transplantation is most commonly performed to the scalp, but using a similar technique, actually the exact same technique, we can transplant hair from the back of the head or the scalp into other areas such as the eyebrows and the beard. So these last two that I mentioned are less common. A lot of people don't know that this can be done, but the results are actually amazing. So number one, the eyebrows. So we can harvest hair with the patient actually in this same chair. The chair actually goes flat all the way down, and we harvest hair from the back of the scalp, and using the same FUE technique in most of the patients, which means extracting each individual hair at a time without using a scalpel and without creating any incisions. Then the patient actually gets in on their back, and we design their brows to restore the hair. This is commonly done in patients that have lost their brows due to overplucking. A lot of these patients have also had other techniques such as tattooing, and some of them actually have had attempted to have their tattoos actually removed. Some of them have tried microablating, which is like scalp, similar to scalp micropigmentation, but with a different technique into the eyebrow, just with the same idea of restoring or giving the illusion of hair. And what we're doing when we actually do an eyebrow transplantation, rather than giving the illusion, we are using real hair from the same person, right, from the back of their head, and putting it into the brow. And that's how we're able to restore brows or eyebrows in a lot of the patients. A lot of these patients may need to have additional procedures such as microblading just to increase the density, but definitely the results of an eyebrow are much better when you have real hair. Now let's talk about a beard. So a beard is actually another area where you can transplant hair. So you essentially take hair from the back of the head and also use it to restore or recreate a beard. It's a lot of patients that don't have much facial hair, and especially patients that like to grow a beard but it's patchy. Those are the best candidates for transplant or to have transplantation of hair from the back of their scalp onto their beard. So these last two are actually other procedures that we perform in our hair transplantation and hair loss center, and that less people are aware of it, but where we can also get really good results, very similar to our results that we can get into the scalp, which is what most people are aware, where we can transplant hair.